Carlton's Travel Adventures. Go get your passport.
What's up? What's up? If you want to learn about health insurance, public health insurance versus private health insurance in Medellin or in Colombia in general, you got to check out this entire video. My personal experience. Check it all out. At the end, you'll see a price comparison and you'll see what I'm talking about, okay? Don't miss the entire thing. It's a great story. True. I try to give you good content. Cost of living, health insurance in Colombia.
Hope I'm not interrupted by this aguacate guy outside. Keep walking around. But anyway, if you've been following my regular, live stream every Wednesday night at 7 p.m. Eastern time, sorry, you realize that, man, I'm having some problem with my stomach again. That's my Achilles heel, right? Didn't start recently. I've had it for years. I had to deal with it. So let's skip to the fact that I had an episode about a year and a half ago, and I got the upper endoscope, and they found nothing, right? Usually it lasts about a week or two, then it's over. I watch my diet, don't eat, drink soup, whatever. This time it's been going on 3 weeks, and actually right now it's probably a month. A long time. So I decided to go see a doctor again. Probably knew the result. But anyway, so I have EPS, which is government health care, which you are required to take if you get your visa here. Everyone's required to take that. All right? A lot of people aren't taking it, but it's required to have that once you have your cellular. Now, even though I have that, there's some deficiencies to that program because it's public health care. I'm not saying it's not good health care, but you have to wait sometimes to see a specialist and get like appointments to do like tests, MRI, whatever, any kind of test you want to take, scan. So if you have the money and these tests are not that expensive, just pay for it yourself. That's what I've done, and I've usually gone back to the Sura private healthcare building, which is on Sura Industrialis. That's a private healthcare when you're paid like a couple $100 a month. I can still go there and pay for it like I have no insurance, which is still inexpensive. Or go to Sura or a private clinic, image center or whatever, right? So that's what I've been doing. I've been doing a combination of both. So I'm kind of self-insured. So when this acted up, I waited, took my regular antacid and so forth. Wasn't helping. Getting pretty bad. A lot of bad acid reflux. Sometimes I can't even drink water. It's so bad. And then just the burping constantly. Sometimes I burp for like 4, 5, 6, 7 times. Just whether eat or don't eat doesn't matter. So it is what it is. So I decided to go in to the center and sewer center in San Diego. It opens at 7:30. If you line up 7:30, go in, get a number to see a doctor. All right, which is not bad. Usually see the same day, or they might have you come back later that afternoon or the next day if it's not too busy. So it's not a bad location. So I went there about a week and a half ago. Just get some feedback, and give them all the symptoms. They said, okay, I'm gonna schedule you to see a specialist, a gastro, so they can schedule you to get the endoscopy, right? Where you can go in and check it out. I always, look, I don't care what it costs. My health is important. So I do these things just to check to see if anything, if you have a lot of gas and acid reflux, if you don't check it out and get on top of it, it can cause some other major problem, especially the big C one, right? So I'm always on top of this. No matter how many times it happens, I spend the money to look, Anyway, so she said we have to see the specialist first to get the appointment to get the test. I said, wait a minute. Before she wrote down the appointment for the specialist, I said, look, forget the specialist. I'm not going to wait a week or 2 weeks. She said, let me check how long it is. I said, no, I don't care. It's going to be a week, 2 weeks, 3 weeks to see a specialist. I'm not doing that. I can take the test, write me a script for the endoscopy and the biopsy, and I will get it done ASAP, a day or two. She So you're going to pay for it? I said, yeah. He said, but your insurance will pay for it like $1. I said, no. It's my health. I'm going to get it done ASAP. It's already been like 2.5 weeks since I've had the issue, right? So what I did, I went down to the Sura Industrialis private location, so Sura private policy. Went in, I spoke to them, made an appointment for an endoscopy, and they said we have an appointment the next morning at the Sao Paulo location, not here in Industrialis, but we have an appointment for the next day at Sao Paulo. Do you want to go to Sao Paulo? I said, yeah, Sao Paulo isn't that far, you know. Sao Paulo in Medellin, not Brazil, all right? It wasn't that really far, all right? So if you take it at the Sura Industrialis location, it's going to be maybe 2 weeks. I said, nah, I'll go to the other one. It's like a, 20-minute taxi ride. So set the appointment up. How much is it? He gave me the bill. Here it is. It's cheap. Here's a cost without anesthesia. They can give you a general. I spray it through your throat. I tried that once. This is probably my fourth one over a 10-year period, or maybe less. You spray it, numb your throat, and you wide awake. Try to get that thing down your throat. Don't ever try that. All I did was gag. The first time I tried that, let me try it. They spray your throat, get you numb. You can't feel your inside of your mouth, just numb. And they try putting that thought down your throat. All you did was gag. Ugh. They said, don't gag. What do you mean, don't gag? How do you control the gag reflex? You know what I mean? He said, we'll try again, don't gag. I mean, that's a stupid comment to make, don't gag. And they tried again. They tried again. I said, don't even try it anymore. I'm not doing it. It'll put me to sleep. Well, actually, it's not totally to sleep. It's kind of in a daze, right? I said, no, I'm coming back tomorrow. This was before, not the time I took it recently. So I knew about that. So I said, look, I'm going to be asleep, all right? Say not totally asleep. I said, yeah, I'm not doing that spray thing. No, don't even try it. So give me the cost of the anesthetic. It's okay. She rang it all up. And she said, well, the doctor usually can take 1 or 2 biopsies and check different things. Check for, bacteria and this other thing called Sysyori, P-S-Y-O-R-I. I forgot what it's pronounced. And you probably know that. And I said, well, give me the cost for both, biopsies. I said, okay. Add it all up. She gave me a number in pesos, right? And I said, that's dollars? It's like 231,000 pesos. It was some small amount, right? And I says, that's dollars? And she said, no, that's pesos. I'm like, well, it's two something, 21,000 pesos, something like that. Well, the equivalent was about $84, right? She said, no, that's pesos. But I'm thinking, even at that cost, it's cheap, you know what I mean? When I thought it was dollars, it was still cheap. She said, no. They laugh at each other like, no, that's pesos. I'm like, and I'm cracking up going, okay. I'm thinking, that's even cheaper, damn. I did the math real quick, that's the $84. That knock you out, do all that, two biopsies, $84. How do you beat that? Sorry, the lights get really bad where I was sitting before, so I had to change it up. And, better lighting right here. Anyway, I think what I left off was the cost. So I got the paperwork. I'll try to print it for you and show it to you. So the endoscopy by itself was 135,254 pesos. The sedation, if I wanted sedation, 80,996. I rounded up, 135 and 81. That's 216. They said. Plus the 2 biopsies they're going to do, 109,000 pesos, right? That came to 325,000 pesos. So I think when they first told me without the sedation, right? I got to remind them that because last time I did it, they gave me the price without the, sedation, and then, when it was done, they added it on. So I was prepared for that. Because they didn't know if you're going to take the spray or the, or the shot. So that's why they said they didn't do it. If you take the spray, it was almost nothing, just a spray. Like really cheap, I don't know, like 10,000 pesos or something. If you get the sedation, it was a lot more. So they didn't put it on. So this time I said, hey, when they gave me the price of 216,000, and I'm like, is that dollars? It's still pretty good. I would have paid it anyway, compared to the US. But it said, no, that's 216,200 pesos. I said, oh, okay. And I said, that's without the, with or without. They said, no, let me see it. So they gave me the sheet. Probably can't see that. I'll print it out. And I said, okay, it's pesos. I just kind of want to make sure, So 216,200 for the sedation and the actual endoscope. Then they had I said, give me the total. We're doing 2 biopsies, not 1. If you can give me back later on the difference if they only do 1. But them they're going to do 2, and they did do 2. So it says 109. So the total was 325,000 pesos, and I divided, and it was $84 US. So it wasn't bad. It was an excellent price, I thought, for all that work. I called a buddy of mine, and I said, do me a favor. Oh, you know my man, DC Rob. Do me a favor. Look at your insurance. And what would that come out to be in the U.S. a year out of pocket? He says $900. You guys let me know what your feedback is as far as what you think you would pay in the U.S. for endoscopy, the sedation, kind of knock you out, and then biopsies. What do you think? Even with insurance, what would that cost? And without insurance, what would that cost? Give me an idea. Okay? All right. I got to look to make sure I got the correct terminologies. So you have chronic gastritis, and it's still killing me today. Breakfast is killing me. So chronic gastritis. It is what it is. So they gave me, a script. I said, do I need to go to a specialist, a gastroenterologist? She said, not, you can, but waste your time, not really. Nothing on the test results. Or they give medication, I give you medication myself. Cute little nurse, the head nurse too. Because when I went, I wanted to see the same doctor who gave me the script to take the test. And they said, well, she can't, she's filled up today. I said, can I get somebody else? You said, can you come back another day or 2 or 3? I said, no. Give me somebody else who can read it. People can read that. Just said, tell you what, I'll give you the head nurse on the 4th floor. She's the boss, and she'll read it for you. I said, cool. So I went to the 4th floor, head nurse. She was kind of cute, really cute. Speak a little English. So between her a little partial English and my partial Spanish, we did great. Another nurse was sitting next to her, just talking, and she moved over, sat down. So 3 of us had a nice little conversation. The other one didn't speak any English at all, but I speak enough Spanish. And the doctor herself, she was a nurse, she's a doctor, and she spoke some little English. I spoke enough Spanish, so we got along really good. But we just sit here, have a good time, And she explained everything to me. Some things she couldn't explain fully. She wrote it down, translator, went back. So we got, she said, okay, I'm gonna give you some medication, oral. It's like an antacid, and another medication. I forgot the name of it is. I got them both here. And actually, give me this. Liquid stuff, and then this stuff here, esomeprazole. I'm probably saying it right. ESOMEPRAZOL. Okay, whatever that is. So take it once in the morning on an empty stomach. Take this after half an hour after you eat breakfast, lunch, or dinner. Take 5 milliliters. I don't have a cup for it though. So anyway, before I get to that, this is the part I want to tell you about as part of the EPOS. Very important, check this out. So she gave me the script, we went over it, what to do and so forth. And she said, well, I'm going to give you prescription for 3 months. I go, you gotta take this for 3 months? Ouch. He said, yeah, when you take it for 3 months to clear it up. But you say, okay, the script is only good for a month. So you need to go into your Sura application website, register. I did it once and I couldn't figure it out as you go through it. So I just got off it. Register, and when the first month is up, to get your second month's prescription, you have to go in and hit renew prescription here and everything else, and and so forth. I said, and it go into the system. I said, what? I said, can I take the script and just go to a regular pharmacy? He said, yes, but you won't get the discount. I said, it's okay. I don't know. I'll do that. Because the last time I got a prescription from Sura, I went to just want to check it out, went to the Sura pharmacy, for the government pharmacy or whatever. I say government, the special pharmacy they have just for Sura people. And man, I walked in the door, it was like full of people. And you take a tag. And I'm going, damn, I'm sure it's cheap enough anyway for me to wait. I buy these stuff like this right now. I have 2 bottles of this stuff. It cost me like, I don't know, $10 or something or less. Yeah, but maybe less than that, So I said, for $10, $15, I'm not waiting in line, all right? So now she said, but you can't get, I said, if I have a prescription here, I go to any pharmacy, get it filled, and the other nurse said, yeah, that's pretty cheap stuff. That's pretty cheap. I said, yeah, it's cheap. But after the first month, can I use the same prescription? She said, yeah, probably at a regular pharmacy, they probably fill it again. It's no big deal. It's not like serious medication. It's this stuff, Just tell me what the name is. I probably buy it over the counter, really, So I said, okay, I'm not going to wait in line, to get this filled. I'll just go get a regular pharmacy and what it costs. I'll pay whatever it is. So I said, cool. She's real cool. We have a nice conversation. We left. Then on the way home, I was walking home, actually walking to a bus stop to get the Uber, because walking to the bus stop to get Uber. Yeah, I had this one location close to this bus stop where this major building is, so it has an address on it. So I prefer to go there or the Uber there, so there's no confusion about where to pick me up. That's why I'm saying that. Walk to the bus stop to get Uber. Right. So against this Yamaha dealership. So anyway, so I was walking there and I said, wait a minute now. You know what? We'll be interested. Let's see what the regular folks that can't afford to buy it go through, okay, with government insurance. So I was passing the location, close to San Diego, where they have the government pharmacy. I keep saying government, with a sewer pharmacy. I said, tell you what, it's early in the morning, it's like 8 o'clock. Let me go in and see how long it takes to get it filled and what it costs, right? Just for you guys, for the viewers. Learn all about the government policy here. So I said, let me go in. So I went in, some videos here, I'll show you in a second. Took my slip, somebody helping you with this also. And I waited in line. So that's how long it's gonna take. So when you check in the machine, they have, different buttons to hit, depending if you're, general prescription versus some kind of priority, emergency, and all this stuff. So they had numbers like where I have SD 069. I did it myself. The lady was helping me. Just said, I said, did I do it right? She said, yeah, I did it right. So my Spanish is good enough. I didn't want to put, emergency or priority. It's a general. But they had tickets that also said, I wrote them down, SF, SG, SE, SH. Mine's SD, 69. And when I got it, they were working on SD 54 was on the machine to be called, 54. And I got 69. Do the math, right? So I'm 15 away. I'm thinking, oh, here goes an hour away, because I see the other numbers are being called faster. The SG, the SH, the SF were being called more. I guess it was priority. And I said, oh, yeah, I've got an hour wait, right? So I said, let me sit here and chill out. And just for you guys, right? It's early enough. So I got the ticket. I wrote it down. At 8:37, I got the ticket. 8:37 a.m. And when they called me up, it was 9:05. So I'm guessing about half an hour. Was not bad. And it was not bad. I think the last time I went there, I waited about 20 minutes and left. It was going slower. So for half an hour, not too bad. So guess what it cost me? It's fill it out within 2 minutes. She filled it. I went in the back, got all the stuff, got me these things. I got a bag next to her, put it in there. But get what it cost me for all this, right? This is a month's worth. $3,057. Let's call it 3,500 pesos. That's it. Was less than $1 for all this stuff. Less than $1 for all this stuff, man. Now I was supposed to go to the pharmacy and see what the regular cost is to check and compare with you guys. I'll follow up later on, okay? I want to get this out to you. My guess is going to be about $10. Because based on what I paid for this, and they said it's cheap. So less than $1 for all this stuff, man. So I'll give it a try. Hopefully it works. But now you have an idea how the public insurance policy stuff works here. Nothing wrong with it. If you're willing to wait, if you don't have the money, or if you have the money, you just want to wait and you're not an emergency, nothing wrong with that. I could have waited and got the test, endoscopy done for probably same thing, like $1, $2, right? When I got the test done one time, they told me it was included, and it's like $1 also. Everything is like, copay is like 3,500 pesos, So I could have saved $84. If you're Colombian, it's a lot of money. It's a big saving. $84 is a big saving for anybody. For me, when it comes to my health, I'm paying $84. Think about how much money you give a chick one time when they come show up, or blow it on vacation, thousands. So I spend the money, and get it done right away, fast. My health is important. So that's an idea of how the public health insurance work here. Okay, it is very cheap. I pay $35 a month, and copay is usually about less than $1 every time I show up. Yeah. So So when I showed up, and anytime I show up for an appointment, it's 3,500 pesos, 3,500 pesos. That's it also. Less than $1 for copay, and $35 a month. Okay. I'll keep it updated on what it costs. Maybe tomorrow or something. When you give me the feedback, by then I'll probably have a price, what it's going to cost at a regular pharmacy. Okay. All right. Thanks for watching. Don't forget the thumbs up. Right. Subscribe, guys. I'm here at the pharmacy place where they get the medicine for the people in Sura, the subsidized medicine, I guess, or the cheaper price. That's where I'm here trying to see if I can get it at a cheaper price. Compared to where I get it at the pharmacy, all right? So basically, I waited at the Sura cheap pharmacy for about half an hour, and it wasn't too bad this time. Last time I went, it looked like a longer line, but I didn't wait. I just went and paid for it. So it's got the medicine there. I waited about half an hour, and it cost all this a month worth of medicine. Cost me 3,700 pesos, less than $1 for a month of medication. So very cheap. I'm not sure it's going to cost at a regular pharmacy. I'm gonna go ask them and so they can tell you guys what it costs at a regular pharmacy. Okay? So I went out to the pharmacy and see the cost of the prescription for those 2 bottles and the medication, and it's 92,400 pesos, or about $24. I use about 3,850, the exchange rate. So you're talking about $24 versus $1. Substantial for someone that's not well off. For us, it's not a big deal. But, so I saved $23 by waiting in line for half an hour today. That's not too bad, all right?